We're here at Waminda and talking with Elvera, who's an Aboriginal health worker. Elvera, can you introduce yourself and tell us where you're from and how you got into Aboriginal health work?
Okay, hi, I'm Elvera Golden Brown, and this is my country here, Yuin country. I grew up in Melbourne though, and I'd always been interested in health even when I was at high school and everything, but I never really got into it until I was 20 and having my first baby. And I'd come up here when I was 18, met my partner, and then we'd moved back down to Melbourne to have our baby, our first child. And I started working at the Victorian Aboriginal Health Service when I was pregnant with her, in reception there. But I was soon moved over to women's and children's area where I worked as a women's health worker, looking after young babies 0 to 5 with the maternal and child health nurse, working with the paediatrician and doing the breast screen and pap screen registers, educating women about that, which I loved. I loved that work. And I worked there at the Victorian Aboriginal Health Service for a number of years in different areas before my partner and I moved back home to raise our family, and that was about 9-10 years ago now. And I started working at the AMS up here, South Coast Aboriginal Medical Service, and I started off at reception there, but soon moved over into health worker work again as a chronic care coordinator in the ITC program, which was great. I worked alongside people with chronic health conditions, helped to educate them and empower them to take control of their own health and make lifestyle changes, and really made a difference. It was really, really fulfilling work and I loved it. While I was working there, I did my registered nursing training, graduated from Deakin University with a Bachelor of Nursing, and still preferred to work as an Aboriginal health worker. I feel I have more range and more ability to connect with my mob when I'm doing that rather than when I'm operating as a nurse. And about a year ago, almost a year today, I moved over to Waminda because, again, women's health is my passion. That's where I always wanted to be involved, was looking after women, children, young mums. And I've been here for 10 months and working with integrated team care here as well, with the chronic care program, and doing regular triage with the doctors and within the team, and I love it. It's just a great place to work. It's a really good place to be involved because it's supportive of workers and community as a whole, and I just love it. It's a great place.
Yeah, so having worked in other services, that's the difference with Waminda, you think?
Yeah, that's a big difference because every other service that I've worked in has had their strengths, and it's been a really, I've learnt a lot from other places, but there's always little bits that I thought could be improved here or could be improved there. And at Waminda, it's where it all seems to have come together exactly the way I thought that would be the ideal way to deliver healthcare and to work with our mob to help our mob to get healthy. It all happens here, which is fantastic. It's like coming home. It's
That's
good.
great. Thank you.